I am going to start today is the Public Health Advisory Committee has released its first report today titled Rebalancing Our Food System. They were established in 2022 and were charged with examining the long-term health challenges facing New Zealand and advise on innovation and practical solutions. The report also looked at the deficiencies of how we produce, distribute and consume food in New Zealand and the approach needed to ensure that our food system supports the health and well-being of everyone. You know, when it comes to food producers, we punch above our weight. Each year we export enough food to feed 39 million people their daily dairy intake, 12 million their daily meat, seafood and other protein intake, 2 million their daily vegetable intake and 10 million their daily fruit, 63 million people in total. However, our food system is also a major contributor to the ill health of New Zealanders. We have poor access to healthy food in the current food system. It's one of the critical pathways towards poor health outcomes as our population. Poor diet is linked to cardiovascular diseases, cancers, diabetes, of course, obesity. In short, the food system we have is very good at producing export quality products that earn a great deal of money, but it's not good enough at ensuring that all of us have access to the nourishment that we need to live and flourish. So what do we do? Professor of Public Health Nutrition at Massey University is Carol Wham, and she is with us now on the platform. Good afternoon, Carol.
Oh, good afternoon, Leah.
Thank you so much for your time today. For a country that produces so much food, how have we got it so imbalanced?
Well, first of all, isn't it great that at long last we've got a report that articulates the problems, because, you know, we have got so much food insecurity amongst families now too. I think with 1 in 5 children being food insecure, which is just really not acceptable for a country that produces such a good amount of food. And it's great to see, the problem is this access to healthy, safe, affordable whole foods is really it's been a systems approach which has let the whole system down, I guess, and particularly with food being seen as a commodity and also a source of economic prosperity. You know, giving food gives us 25% of our GDP.
Yeah, right. And is the wide accessibility to the low-cost, less healthy foods and drinks, you know, the high-fat, the sugary, the processed, I gather that adds to unbalancing our food system.
It really does. And unfortunately, in communities that are the most deprived in New Zealand, we know that there's a higher concentration of unhealthy food, you know, high in fat, sugar and salt. There's a higher concentration of fast food outlets, for example, around more deprived neighbourhoods, and a higher ratio of unhealthy foods in supermarkets in those neighbourhoods. I mean, it really is a bit of a wicked problem.
Actually, I'm glad you mentioned that, Carol. I was going to ask you about where we live. Does it determine the food that we have access to, which you've pointed out? So, I mean, if we even take Auckland, for example, you know, our biggest city is drowning in a sea of junk food. Residents spend more than $1.2 billion annually on fast foods and takeaways, and like you said, in areas maybe like South Auckland, they will have a higher percentage of the big takeaway establishments. And in those results, those are determined. I mean, these places are going in there, aren't they, knowing that they've got a captive audience?
Yeah, I mean, there are suggestions that perhaps the fast food industry buys real estate, you know, in the most concentrated, high population areas, and you know, where people are disadvantaged, and you know, they might not have the equipment and the abilities and skills and motivation to prepare home meals, and they might not have the access to be able to buy whole foods to prepare home meals. This is a really serious problem. And the problem is that a lot of highly processed packaged foods tend to be predominant in areas, convenience stores, for example. If you think about the service stations, the kinds of foods that they distribute, they really don't provide, the healthy whole foods that people need to access in those communities.
You mentioned actually skills and motivation, and I want to ask about that because in this day and age, is that really an excuse for somebody not to know how to put a good meal together, like a healthy meal together, to have the skills to do it? I mean, or the motivation. I mean, if they haven't got the motivation to do that's on the person, isn't it?
I think it's not an excuse. It's to do with, families that live in poverty. This is where the system comes in, the education system, the health system. It's like what we're talking about at the moment. Some children not attending schools. It's not through any fault of their own, in actual fact. It's just to do with intergenerational poverty and what happens in those kind of families. In those kind of families where it's very difficult, to buy healthy foods from a supermarket, young children don't get the role modelling that they would normally get, to actually sit and enjoy a healthy meal sitting around a table. I know of lots of cases, for example, where, families have to revert to things like 2-minute noodles. And I just had a look at some packaging of those recently, where you can buy a pack of 5 for under $5. So the thing is about those kinds of foods is, I think 2-minute noodles might have 60% wheat, but the rest is made up of palm oil, which is a saturated fat, and some, I hate to say, 30 odd other ingredients, which are stabilise and flavour enhancers and so forth. So, this is really not food. But I saw a great big bin of it at Pack and Save recently, so inexpensive. And if you're really having difficulty, with purchasing healthy food, I mean, this is just, what people actually have to buy to feed their families.
But Carol,
it's a wicked problem.
It is, but wouldn't the manufacturer of, say, the 2-minute noodles say, well, we understand that people are struggling, and at least they're getting something. If you can get a packet of 6 for under $5, this is it. I mean, you don't want that kind of thing to go away, do you?